My name is Jan. I'm suffering from autism, Asperger's syndrome. And with that, I am, thanks Professor van der Gaag and Professor Van Os, financial support, being able to be here and to be able to function in the board. I would ask you two questions. One question is, there were in the past very successful, what is called very successful Asperger's, but I want to show that when Asperger's in the past or now do not get help, the shadow sides of their function is serious. One of the most successful Asperger's, probably Asperger's, because you cannot diagnose, because there was no diagnosis there in that time, was Einstein. He's seen as very successful Asperger. But when you know the history, the sad history of the relation with his sons, who he mistreated so bad that they had to go to psychiatric hospital, and that he, as father, was not aware that it could be useful to visit them in that hospital. Then you see what happens with Asperger's when they are not informed about what it is to be an Asperger, or what the social problems can be. And the other one is the very successful philosopher Ludwig Wittgenstein. Probably he was Asperger, and he is successful in philosophy. But now we have to do in philosophy the shadow sides of his philosophy. He makes logic to the core of philosophy as criterion also for psychiatry, and people are not logical beings, so you cannot do that. That is a kind of autistic treatment of thinking, but that's another problem. That's for philosophy. Yeah. The second question is, when at this moment, even when these Asperger's could be successful without help, it is a great tragedy that so much Asperger's are not even having a job or involved in the work market, or involved in work. So a lot of great talents, capacity, ability is not used at this moment for building up a great and good Europe, social Europe. What do you think about that?
Yeah, well, I think you're raising an interesting point. You know, there are many things we can say about it. One of the first things is, and Simon Baron-Cohen will be addressing this during this conference, I think we should make a differentiation between disorder and condition. There are many people that have an autistic condition, aptitudes that enable them to function well in all kinds of fields. And when you take the evolutionary theories that Patricia has elaborated in the men-women differences, it's obvious that autistic thinking somehow brings things to society. You know, there was a little bug on the ICT, but ICT couldn't have been conceived without the perseverance of autistic people who translated all kinds of analog processes into digital processes. So, but there is always a very difficult borderline between functioning and dysfunctioning. And when you talk about people with Asperger's that are very, very successful as scientists, they can be very lonely as people when you refer to Wittgenstein, or they can be very odd in their social aptitudes when you refer to Einstein. And the optimal fit is when the capacities match to the expectancies. Temple Grandin is a wonderful example of someone who had these very, very special skills in visuospatial capacities, who was able to construct all these cattle farms and help herself with the squeeze machine in the process. So I think it's an important point. You know, one of the second issue you're raising is really a matter of concern. When I think about the increase of the amount of autism conditions, and especially the impairment due to Asperger's or PDD-NOS or autism, I think that we're dealing also with a cultural phenomenon, that our society is putting so many demands on flexibility, speedy information processing, multitasking. So people who had a touch of Asperger's 30 years ago could function really well, and now they are nowhere in a market where everyone has to be very, very independent, flexible, and so that's that's really a political matter of concern. You know, because we're leaving out a lot of talent because we think that everyone has to be independent and doing well, and we tend to cut down on very basic support that could help people with Asperger's functioning well in all kind of work situations.
Just respect of that, right? Because that's a fascinating point. It reminded me of an anecdote I'll just relay that really emphasises that. One of my students is doing a series of transcranial magnetic simulation studies, and we were recruiting subjects, and we had a group of undergraduate students working with us, a group of 7 or 8. In psychology, you tend to get female students, and I had 7 or 8 very attractive young women working with this PhD student. And so all these autistic boys were coming in and suddenly being overwhelmed by all these rather attractive young women around wanting to hit them with this large transcranial magnetic pulse on the side of their head, which feels like someone tapping you on the side of your head. But one of the autistic boys that came in, who had had a remarkable level of early intervention, a young fellow by the name of Simon, turned up, and all of the girls and my PhD student, who had not been told beforehand which ones were autistic and which ones were not, were all completely convinced that this young man was totally normal. He was one of their control subjects. And they commented to me, he was being sarcastic. He was being humorous. He was cracking jokes with us. And interestingly, I said to him, well, actually, that one was autistic. How come you, and he's quite thoroughly autistic, how come you didn't spot it? And what it was the difference between, I was looking at the data about him from some years ago, and since his diagnosis, he has had parents who have put a lot of effort into providing early intervention and support and training. And what this says in support of what Ratke was saying, is that if we provide this intervention appropriately, it enables these individuals, enables all individuals, to overcome some of the extremely demanding conditions that society are placing upon individuals today. It's a matter of resourcing and assisting and supporting.
At University of Catania, there are 2 students with Asperger's syndrome who have the 1st degree level, and one of these now are involved in a working approach. They are all good supported from 2 or 3, 4 years of age. And the first goal in adult approach has been to increase their autonomy. This is fundamental. Okay.
Hello, my name is Nicole Reinhardt from Australia. Thank you for an excellent presentation. It was fantastic, and it sounds like it's showcasing the next 10 years of empirical data we're going to be seeing in this area. Just a reflective comment. It's interesting listening about the profile that's emerging, that's distinguishing males and females with autism. And the profile issues are reminding me of the discussions between high-functioning autism and Asperger's disorder. If we reduce everything to the mean, we don't really see any differences between the 2 conditions, but if we look at the subtleties of the profiles, we see a lot of important differences. I was just wondering if the panel could comment on differences between girls with high-functioning autism compared to girls with Asperger's disorder. Just thinking of my own work, noting that the girls with Asperger's disorder, like the boys, get diagnosed a lot later, and they often have a lot more environmental adversity because of that being misunderstood for a lot longer than perhaps the girls with high-functioning autism, which I think speaks to sometimes the issues of thinking about Asperger's disorder as being a milder form of autism, when sometimes life is more tricky for these very bright young people. So I'm wondering if the panel could talk about any data that you're aware of, if you have, that tells us a little bit more about girls with high-functioning autism and Asperger's.
Well, you're raising a very important question, but a very difficult question. And the difficulty refers to taxonomy. Because, you know, there's a lot of diagnosis Asperger's around that would not fit the DSM classification. So I think one of the big problems is that we do not have proper research because the criteria did not enable us to. But if I translate your question to the difference between early onset, high-functioning girls that grow to be adults and the one that you see in adulthood, that's a very, very good question. And interestingly enough, Patricia and I were just saying we have to go into those data. We know from those 278 cases that we saw in Utrecht and Zwolle, we know when the diagnosis was first made. But we didn't take them into these analyses, so I can't tell. But it's a very important issue because, you know, it raises the question, in first instance, what can you do in terms of intervention when you identify high-functioning cases early? How can you prepare them? Well, we've got some very good incentives and advices for, you know, because the ones that are diagnosed late are often not only damaged by the adverse life events that they've encountered, but often also damaged by psychiatry and psychology because they've been misdiagnosed for a long time, you know, and it's very sad when you've been bullied around as a borderline personality disorder or a bipolar or anything, and it takes so long before there's a real diagnosis. So we're going to compute it. We hope to present in a couple of weeks an answer to your question, but that'll be in New York. So I don't know if you'll be around, but we'll write it down as soon as possible. Okay.
Yeah, g'day, Nicole. Fascinating, and actually something that I might get Tori to look at in her data, exactly using the same approach to compare AS to HFA. And the approach that we used is amenable to looking at that data. You'll know that my particular bent on it is that I tend to say there is no difference, but that's because I'm trying to be very scientific about it until I see a good set of data to say difference. I understand that it's useful diagnostically, but at a scientific level, I find it very difficult yet to discern. I know that you've done some interesting work in that area, but we should certainly look at that with the kind of techniques that I was using, which avoid the problem of mean differences, that look at the structural underlying subtle differences. Certainly, but that's something I'll be pointing Tori at to look at in the future.
From an educationalist point of view, we find that the intervention, to me, I look at the interventions, not the diagnosis. So I agree with you. I'm not too sure. There's no such thing as a straight line, as Lorna Wing says, so where they fall. But when it comes to the interventions that are required, the same interventions are required for the teenagers with Asperger's syndrome and those with high-functioning autism. Yeah.